All right, Dr. Malone, this is it's April 23rd. And we are in downtown Pensacola on April 23rd. And we are coming to you live from Zarzaur Law. And the street profile, I think because of the storm today, is not so impressive. Or it is impressive if you're looking for people to social distance. There's only three cars on all of North Palafox, north of Romana, so which is good. Where we are now is we are. I just got finished watching a little bit of the president's news conference. What got my attention was the guy that didn't look like a scientist, but he worked for the Department of Homeland Security, and he was talking about like real world, like germ killing stuff. So that really got my attention for some reason. But he was talking about how quickly you can kill the virus with alcohol versus other substances. And if you rub the alcohol on the surface, that it went away even faster. And then he started talking about how the UV rays on a porous and non-porous surface can kill the virus as long as it's not a shaded situation where it's got to be direct, I guess, direct sunlight, like what's coming into my face right now. And so in any event, I thought it was interesting because for the first time we're hearing about some practical ways to control the virus, which until now we've always heard is wash your hands and stay away from people and wear a mask. The idea that your environment can actually make it less conducive for the virus to propagate and to infect is, I think, is an important thing. So in any event, I know you have an agenda that's a lot more sophisticated than mine when it comes to this virus. But so can you go ahead and start talking to us about the numbers today? Because I know they went up. I think they went up.
Well, let me finish the point there about the humidity and the temperature. First came out, one of the videos we did like 5 weeks ago was they weren't sure if it was going to have a seasonal effect, you know, like when we got into summer. And so this isn't seasonal, this is environmental stuff. And so to know that an environment can impact this virus, we didn't know that many weeks ago. Now it's been studied for the last 4 weeks and we have some data, which is great to see it being released. So higher humidity, higher temperature, more UV, and the lower the half-life of the virus itself. So that's all good information. We're doing that based on just anecdotal stories beforehand. So that's something that I think we'll get more information. I'll try to get the slides for tomorrow to show that. As far as the numbers locally, surprisingly not a lot of movement today. I kind of thought we'd see some movement with the long-term care facilities that were tested earlier in the week, and then with the walk-up testing yesterday. So we've only added a couple to the mix today. We're up to 420 diagnoses, and last night we were at 418. However, then they backed it off to 415 later in the night, like in the evening. And so I don't know if those are false positives or just a data entry error or whatever. But since yesterday, it's only gone up a handful of cases locally.
How do you know if those include the walk-up testing centers?
The numbers that the state's putting out, they have to include those. That's part of the. In fact, people that are getting any of the other testing at any kind of facilities that are done privately still have to report to state and local jurisdictions. That's kind of the agreement. So I assume that they're going to make it in there if they haven't made it in already. And so like the walk-up testing yesterday, I would imagine the earliest we'll see those numbers will probably be tomorrow. They're probably resulting and not really available into the system. And I say that only because we really didn't see a big jump in the total tested from yesterday. So yesterday, the total tested was 5,223. Today's total tested is like 5,500. So a couple hundred added in our county. And, you know, they tested 250 from that one walk-up site yesterday.
Do you know how
while
long
they had
those? Do you know how long those tests are taking to get back? Those walk-up clinic tests?
I don't, and they didn't publicize that. I know that the turnaround time in general is sped up quite a bit from when we first had this at the outset, where it was, like a full week. So I would expect at the earliest, tomorrow. I kind of was thinking maybe we'd see it today. So we'll keep following along. I pay attention to the total amount tested in the county every day, and that kind of gives you an indication, like, okay, we had a big load come in. So
when do they typically do the updated numbers? What time?
They do it 5:30 our time, so it just happened a few minutes ago. I got these like literally as I was logging on to this Zoom room with you. So it's 5:30 our time, 6:30 Eastern is what they have it for the evening update. They do have a morning update as well, and I did track this earlier this morning. We're at 418, and now we bumped up to 420. So just added a couple during the course of the day today.
It's interesting you use the term 420 this week, but the fact that that we have hundreds of people that are being tested at these walk-up clinics, I have a stinking suspicion to believe that maybe those walk-up clinics those test results are not back yet, because it seems like there'd be more than 2 people that would test positive for this out of those hundreds of people that tested, but maybe, I hope not. But
yeah,
maybe.
Well, and I think you're right there. And then when I compare it to the total amount tested, I didn't see the big leap there to account for the 250 whatever they tested. I mean, we went up the same rate that we've been going up the other days. You'd think that with adding some extra bandwidth with another test, and it took 250 in one day, that you'd see a big leap with the day those things get registered into the system.
Right.
So,
okay.
Sadly, social distance score, we're now is a state D plus and locally D minus. So that's again the lowest grade we've had on record, and that dates back to like the middle of last week. So now here we are again at D minus. So as you mentioned, I think people are getting the indication that, hey man, we got this thing licked and let's move on. So I'm going to continue to track it.
And this heat thing is just going to make that worse. I mean, because as soon as people in Florida hear, oh, wait a minute, as long as you're outside, you can do whatever you want.
Hot and humid.
Hot and humid. We just go outside and we can do whatever we want. We're good. So I'm not sure if that's a good thing to be publicizing or not, but I'm certainly thinking that people here are going to think that means they can go outside and do whatever.
Well, and then the gentleman from the DHS did just say that they had done some tests in some rooms that they heated up to like 95 degrees. So if you're not in Florida, you're a different part of the country, turn your furnace on. that's
Wait a minute.
probably going to happen.
I thought it was a UV, actually the UV rays themselves, because somebody had said, well, does that mean that if, like if you're at a playground and the playground equipment is outside, and he says, well, if the playground equipment is within direct sunlight, then the stuff that's on the surface of the playground equipment that's in the direct sunlight will be killed. But underneath on the playground equipment that's not in direct sunlight, the virus wouldn't be killed there.
No, you're right. So, but they did say that temperature alone, without any UV at all, diminishes the half-life of the virus.
Wow.
So you could be in a hot and dark room. So if my assumption is that comment he made is if you're in an environment that's not Florida right now and they're having sun in Ohio and the temperature is 60 degrees, the sun could still kill it even though it's 60 degrees, but underneath in the shade, you don't have heat, humidity, or sun. So you don't.
And we've got all that here.
Yep. Except for today.
Right. All right.
So otherwise, the long-term care facility numbers locally went up to 142 most recently, and that was like released middle of the afternoon today. So not a big leap. The big leap was yesterday. I understand that a couple other facilities are having some mass testing, at least on their scope. So again, when we see that jump, we'll report it or at least make note of it. And the only other thing I saw locally that was interesting, and I'll be interested to see the follow-up on this, is there was a patient at Baptist Hospital that started the plasma treatment. So that was something, so to get the convalescent plasma. So right now they're obviously not releasing a whole lot about the patient, but apparently it's been initiated or was going to be initiated today after they secured the plasma donation. So it's happening in our community, folks. Let's see here, interesting stuff. Let's see what I had to share here today. So let me get to, all right.
And what's the plan?
Again,
Is Florida going to open up? What are we opening up first?
Florida or Escambia County, or
do we know
locally?
Do we know?
I don't think, I haven't seen any word about the city of Pensacola or Escambia County. Nothing in the news yet. The closest thing that I saw locally in the news was Santa Rosa County is going to open the beaches for like 5 hours a day, starting at like May 1st or something like that. So
Okay.
that's going to be their plan to try and I guess limit this at the outset. All right, so a couple of interesting things. I saw this in the news a few times over the course of the day today. And again, we talked about this when this thing first came to us. We didn't know any of the risk factors and all that. And now here we are, we're putting some studies in place. So of all the hospitalized New York City area individuals, they're finding that a huge proportion of them had at least one comorbidity, and the most common one that they shared was hypertension, and then obesity, and then diabetes. And these three things are unique to the United States. Prior to making it here, we didn't have this data. One could have either guessed or assumed, but now we had to back it up. So the American lifestyle, hypertense, obese, diabetic, or pre-diabetic, that is shared in the hospitalized patients in New York City with the 5,700 that they had. And this was listed in JAMA today, or I think last night, but I pulled it today. So no surprises there, but we put a study behind it. So that's.
I have a question. Why does
hypertension?
Why does hypertension in and of itself, if you didn't have any other comorbidities, so you had just hypertension, you didn't have obesity, you didn't have diabetes, why would hypertension just by itself cause you to be more susceptible to have a critical outcome from this disease?
The microvascular, the small vessels in your body, mean that some important organs aren't getting the blood supply that they would need because of just pressure over time. It causes them to shut down or become hardened, so they don't respond to stress like the rest of a more compliant vessel would. So that's probably part of it. The other part is hypertension is actually a disease of the kidneys. People think, oh, it's a heart condition. It's a disease of the kidneys, and it's based on hormonal feedback on your body. Your kidneys are the thermostat and say whether or not they need more or less pressure. Heart does. So being that it's a hormonally induced system, I think there's probably some component there. And then lastly, the receptors that these viruses attach to, the ACE2 receptors that you've seen, that's where the term ACE inhibitor is associated with all this. So they think that that might be part of the interplay, though the whole receptor mechanism has not been figured out. Trying to figure out how we can hack this thing and shut it down is kind of the key right now. So I think it's probably a few different things. There's no one answer like, hey, you have hypertension over a certain amount, like, hey, your blood pressure is 180, you're going to get it. I think it has to do with how it's affected your body over time. So if you're been hypertensive for years, I would take that to understand that you're going to be at increased risk versus someone who just got diagnosed with it and like you maybe take one pill a day kind of a thing.
All right. So the lungs obviously are full of blood vessels, right? And so
yep.
You've talked about these sacs in the lungs, the alveoli, is that right?
Alveoli, yes.
Thank you. And I guess there's little tiny blood vessels that go to those?
Yep, and that's where you get oxygen from the deoxygenated blood
and somebody
from the heart.
There's somebody that has hypertension and doesn't have obesity and doesn't have diabetes. You're saying that those particular blood vessels that make the oxygen carbon dioxide exchange happen, those can be damaged from years of uncontrolled hypertension, I guess.
Yeah. So instead of being a nice compliant vessel that changes diameter on command at the command
Right.
of your body.
Right.
It's more stiff or rigid, and so it doesn't respond to when your body needs different distributions of blood throughout
Gotcha.
the lungs, for
Okay.
instance. So I think that's probably the underlying one of the underlying components. So it's probably multifactorial. I'll look and see if they have any other information on it. To see that association was the first thing, the number one.
It sounds like
common.
blood flow is basically, if you got anything that impedes your blood flow, those little bitty arteries in your lungs are gonna suffer first because they're tiny little blood vessels. And so is that what basically they're saying? It's like you got anything, obesity, diabetes, hypertension, anything that affects blood vessels, blood flow, it's going to start affecting those that are smallest first, right?
Yeah, and you think about it, the cytokine storm that we mentioned a couple of times, the body, the blood vessels of the body fill up with all these pro-inflammatory components, and it makes your blood thicker. These people are developing clots and having strokes and all that, but it makes your blood thicker. And so you're trying to pass something thick or more viscous through a already tattered up, that's tattered up because of longstanding hypertension. So it's probably part of the I'm hypothesizing now, but that's kind of how when people so tell them
I did. I waved. He's delivering food to somebody. I wish he was delivering it to me. That looks good. Whatever he's got, it looks really good. So, all right. So sorry, I got distracted by sushi. I apologize. It's been a while since I've had some. All right. So what exactly that study is basically of, I think it said 5,000 patients in New York City. And
the 5,700 hospitalized patients.
Okay. And how many of those passed away from the disease?
Good question. Let's see if they quoted that or not. Let's see here. Let's see. 21%. Let's see. Among the patients who were discharged or died, 14% were treated in the ICU, 12% received ventilation, 3% treated for kidney replacement therapy, which is dialysis, and 21% died.
Wow, that's a pretty good number.
Yeah, so 21% of 5,700. So
okay, so let's do this. How prevalent are those three things in America? Is that the whole 30% thing we talked about, or is it a different number?
It's probably more than that, because when we were talking about that, we were just talking about obesity and individuals under the age of 65. So the prevalent, the percent prevalence, if I had to spitball, I'd probably say population wide, probably at least 50% obese.
50%.
That's if I'm just spitballing. I don't.
Hypertension would be higher than that, right?
I would think that half the population has probably got some component of hypertension, whether or not they know it, and whether or not it's medicated.
Help me understand this part. Okay, we're talking numbers, and some of these numbers just get scarier and scarier. But there was one thing I heard today that I didn't think about until somebody said it.
100 million are obese.
Okay, wow. Less than 5% of our population has been affected by this virus. Infected, not affected, infected. And in order for us to have herd immunity, or in order for us to not worry about this virus in the absence of a vaccine, in other words, it becomes something that we can fight off on our own. 60 to 70% of the population has to have it.
Yeah, that's the herd immunity.
Okay.
They have to have the antibody to it or the vaccine for it.
Okay, so we either have to run and hide from this thing, so to speak, in our houses and clean up and be extra cautious about who we talk to and wear masks, or we have to get it and beat it, or enough of society has to get it and beat it where we, I guess, evolve the virus itself, so that we basically change the way the virus affects humans by the number of people that end up having it. Is that pretty much what you're saying?
Yeah. So the way herd immunity works is, think of the game telephone, where like I tell you something and then you turn on, tell it to the next person, and the next person, next person.
Yeah.
If half of us weren't able to speak, if we were mute, then the message stops.
Right.
And so that's how the virus happens. So if the virus infects you, or tries to, but you're immune, then you're not going to pass it to the guy next in line. So
Okay.
the message stops.
Gotcha.
So that's my best way of thinking about that. So the idea is, if you get, 60 to 70% of a closed population, which that's the difficult thing when people start talking about herd immunity in the United States or in America, when travel opens back up, it's not a closed population. You're talking about a
Right.
worldwide population. So now you're
Right.
talking about 2/3 of the world. So in a closed population, when you have about 2/3, 60 to 70%, that's when you achieve herd immunity for this virus, they suppose. For influenza, it's only 49%. 49%, we had herd immunity like last year. We
Right.
didn't have a pandemic. People still got it, but they didn't spread it as much as they could have, because people had had the vaccination and the message stopped. Like I just said, where someone in your house has it, you don't get it because you had the shot, and the message stops. Your whole house doesn't get it. That's how herd immunity works. So other numbers here I just pulled up.
I have a question on that. I have a question on
Yeah.
that. Just a second. Let's say you're in a family and one person got this flu shot, and 4 other people in the family did not have the flu shot, but there was still a positive flu member of the family. Just because one person in the family had the flu shot, how does that protect the other people in the family that didn't have the flu shot from getting the flu?
So in that scenario, your closed population is 5 people, so only 20% have been immunized, so you don't have herd immunity.
Oh. So if you had
closed population, population you're talking about.
Okay, well, explain it to me then, in the sense, let's say that of that closed population, let's say 2.5 people had the shot, or 2 people had the shot. So then, or 3 people had the shot, to make it easier, because you said 49%.
Yeah.
All right. Now, how do those 3 people who have the shot and the one person that has the flu, there's still another person in the family, right, who doesn't have the flu and doesn't have the shot? Why are they protected?
Well, because presumably you don't have one-on-one contact. You'd know you're sick, and so then you'd say, well, all these assume that you're taking some level of precaution and not exposing yourself to a sick person. So if the other 3 people could help care for the sick person, the 5th person doesn't have to do it, and then they never get sick.
Okay, right. So,
they don't have
theoretically, the person's not vaccinated. You don't get some kind of imputed immunity just because people in your family are immune.
No.
That's not the way it works. It's just the numbers don't work out because it ends up not being able to translate or transfer from vessel to vessel.
So your chances of getting sick in that setting, if you were the one person that did not have the immunization, your chances of getting sick lie on contact with one person. Whereas if nobody in the house was immunized, your chances of getting sick lie on contact with 4 other people.
Okay. All right. So what else do you have for us tonight?
Okay, so real quick, just to tie that bow on, 100 million adult Americans are obese. 1 in 10 adult Americans have diabetes, and 1 in 3 adult Americans have hypertension.
All right. So, and a lot of those are overlapping.
Yeah.
So,
Oh yeah. A lot of them. If you had a Venn diagram, a lot of them would be right at all 3 points of overlap.
Okay. Wonderful. Okay.
So,
all right. That doesn't sound great, but we'll just keep on moving. Is that
All
why
right,
we have more deaths? Is that generally why we have more deaths than every other country proportional wise?
Well, that's why the leading causes of death are cardiovascular disease or cancer, and both of those can be tied to or associated with any of those conditions. Yeah.
Okay. I saw an article in the paper today that the hospitals are worried that people aren't going to the emergency room because they're scared of the coronavirus. Did you see that in the local paper? I think that was in the local paper today.
Yeah, I did, and that's the second the news channel had it on last week from one of the ERs, encouraging people to not avoid the ER if they had a reason to be there.
And you know, we've been telling clients the same thing that are involved in car wrecks. Look, dude, the emergency room is not going to be cleaner than it is right now. I mean, you pick a day last year and go to the emergency room, I guarantee you, if you walk around the emergency room and did random samples on the chairs and on the surfaces at the emergency room last year this time, you would find more stuff last year swimming around in that emergency room, microscopic wise, than you would today. Because I guarantee you, somebody is in that emergency room waiting area taking care of business. You know what I mean? For the hospital.
Oh yeah. And they're triaging. They're
triaging before they get there. So anybody that has any kind of cough or sneezing process, they're probably going to be put way out to the side somewhere. And under normal conditions, I'll call them normal, they'd be sitting up in the emergency room right next to you, like in the next chair. So
wrapped up in a blanket, sniffling and all that. Rewind a year ago, and that probably was very likely.
With a cup of phlegm, you know, in their hand.
Yep.
And whatever else
now
they're coughing up.
Yeah. Now if you have a sniffle or a cough, you're sectioned off into a different waiting area. So
not to mention nobody's gonna get anywhere near you.
Yeah. So. All right, so let me pull this up. We touched on this last night.
So don't be afraid to go to the emergency room.
Yeah, that's the same thing we've been saying, and I'm glad that the news is picking up on it. Maybe especially
if you're having chest pain or the other leading causes of death in America that can be prevented by you getting early care, strokes and heart attacks and those symptoms that you should not ignore.
Mm-hmm. So,
and for our purposes, the car wrecks.
Yep, I'll pull this up. This is the hydroxychloroquine study at the VA hospital. We had mentioned it last night, and maybe it didn't necessarily show great results for the use of hydroxychloroquine. Right. And so I pulled it up and read through it, and I guess I have some critiques of the study itself, and I mentioned a couple of them last night. You know, the VA population, God bless them, God love them. You know, they're heroes and they deserve all the care that they're being provided. But the population itself is not representative of a cross section of our community. So you have to take that with a grain of salt. So generally older males with you know, other comorbid conditions. And it's kind of what this study shows. They use the drugs in people who were beyond the point where most of these institutions are using it. So you look at some of these protocols, and we had one up a couple of weeks ago from Yale where they're using it pretty early in the hospitalization. Here they waited till pretty late till these people were like in the ICU and either already intubated or on the way there. So to give I don't know if it gave the drug a chance. The other thing is Zithromax was actually, it's part of the cocktail, right? So in their control group where they said, yeah, we didn't give people the drug, those people had Zithromax on board because they're being treated for pneumonia, like bacterial pneumonia. Mm-hmm. So I don't think it's the cleanest data. And I'll be interested to see. If we have any other studies. There's hundreds of other studies out there now that are being conducted and data that's being collected at different collection sites. So we'll see.
I'm a little concerned. I'm a little concerned we're being a little too loose with the studies. Like, seems like to me that, you know, before anything was published in any kind of journal, that it was critiqued and peer reviewed and all this. And now under these conditions, it seems like they're printing everything. They're just printing whatever somebody wants to submit.
Yeah, and so that's the one that I have here. This is what they call a preprint. So it's before it's been peer reviewed. And the idea is you get the information out there so that other people conducting studies can extrapolate from it, not to make clinical decisions based on it necessarily. This is, I guess, think of, you're basically just, you're trying to share information as best you can to take this thing on as a group effort. So these preprints, websites, and databases are hopping right now. And it's someone will put a study out and it gets peer reviewed in real time based on all the results of the message board and all that stuff that are tagged to it. Sometimes it's entertaining. It's scientists arguing, and it's like watching an argument on Facebook, where these people have really nothing to gain or lose. They're just behind the keyboard saying, no, you didn't do this right, didn't do that right.
Nobody's
I'm gonna do my own study now.
Nobody's convincing anybody of anything.
Yeah, so and this is one of those studies, and there are multiple studies that we've mentioned over the last many weeks where they have not been peer reviewed, and I've tried to point out when it's not been, and this is one of them as well.
Right.
So take that with a grain of salt when you do see it on the news, and the news, if they're pinning it to a headline, should say somewhere in there if it's been peer reviewed or not, and chances are nowadays it's probably not, unless it's made it through a formal publication process in a established journal. All right, so
and it wouldn't be timely if it was.
Yeah. So, all right. So this is a kind of a fun topic here. All right. So they have this hypothesis. Let me pull up the first one here. So this is the first one. All right. So smoking, vaping, and hospitalization. If I had to just ask you, like, what do you think? Like, you think these people get sick and get in the hospital? Smokers and vapors and all that? You think they do? Yeah,
I don't.
Right?
Maybe. I mean, there's, maybe they're breathing in so much that they're protecting their lungs somehow. I don't know. Maybe there's no telling.
Well, so the idea is if you have bad lungs, you're going to be admitted and you're going to be really sick. But so bear with me for a second. So they took data from China, and it's so prevalent. Smoking is in that country is so prevalent. Okay, that over half of the males smoke, and then they realized that like this doesn't add up. Like, we're not seeing these levels of sick people in the ER or in the hospital that smoke, and they thought, okay, well, the solution or the reason is these people are coming in so sick that no one's taking a thorough history. They're not having the time to sit down and say, do you wear your seatbelt when you drive? Do you feel safe at home? How many packs do you smoke a day? They're skipping that step. So they thought maybe the data just wasn't being captured. So, so on with that. So now you have another group, and this is a group in France, where France has got significant smokers, a significant amount of smokers, and they realized that they had a much lower proportion of cigarette smoking patients being admitted to the hospitals. So the theory isn't that cigarette smoking is protective. The theory is that nicotine is protective. And so now you have a group in France, and so the title is the nicotinic hypothesis. So the receptor for nicotine, the nicotinic acetylcholine receptor, interplays with the ACE2 receptor, microscopic level in our bodies. So they're going to conduct a study. They just started it, where they're using transdermal or nicotine patches and putting them on patients. So, so the idea is, let me flip over here with what their proposal is. They go into a whole. In conclusion, we propose and try to justify the hypothesis that the nicotinic receptors play a critical role in the pathophysiology of an infection by COVID. As a consequence, we propose nicotine and nicotinic agents. So they're going to give them the patches. We're going to use them as a way to discern whether or not these people do better or worse with giving someone nicotine. So you come in sick, there's a chance you get a nicotine patch put on you.
Oh my God!
As you're in the hospital.
Kidding me.
So, no.
Wow.
So, but they still do say, they have the caveat in here. They specify that they're not encouraging people to start smoking to try and protect from this. So you can still get infected, but for some reason, these people, they think the nicotine might be interplaying with the way the virus attaches to our cells.
Wow.
And blocking that. So be wary of how they're doing that, but we'll pay attention for that when that study comes out. But it's the weirdest thing, you get into the hospital and put a nicotine patch on and say, I don't smoke. Like, well, we don't care about that part. We want to try and limit this virus. So I think that's an interesting study. And So I think that's harmless to put that on people, just to see if you have a difference in the outcomes. You have to treat them the same otherwise, though. So, all right. And then the last thing I had here was, this kind of goes back to what you had led off with about, oops, hold on.
So I'm still on that thing where this alcohol kills it on contact or something. I think you said something like that.
So that's what I was just about to get to.
I saw some people in China on TV yesterday. They were spraying people down as they were walking in this hotel or hospital. Like they had like a spray bottle and they were like spraying the person down, like head to toe with a spray bottle. And I was thinking, what is that doing? But now, after this guy was talking today on the press conference, I'm guessing they were spraying rubbing alcohol all up and down the person.
Yeah, here, let me pull this link up real quick. I might go away for a second, then I'll get this. I'll be right back. And, all right, so the CDC put out a pre-release here. Oops. Let's see here. So get this website up. So the CDC put out a pre-release, and just at the outset of this, what do we say? You and I did a video in the first week saying 70% rubbing alcohol or 70% ethanol needs to be in all these hand sanitizers, right? So here we are. They put out another early release, and they recommend that now they've done the studies on this virus. So that 70% that was being recommended was based upon what they knew about other coronaviruses, like the we've dealt with in the past, or SARS. We didn't have any studies on this COVID infection, so now we do. So the study is pretty interesting to read. They go through it and they talk about all the, I mean, these are people in the lab handling this stuff, this virus. I mean, it's scary to think about. Anyhow, the synopsis of it is this. They said that they have found that the two formulations that were recommended at the outset indeed do kill the virus. Caveat being that 30 seconds of hand, like wiping it on your hands and letting it dry, 30 seconds was the cutoff. You don't just put it on it and it dies. So you have, and they say in a hospital setting, sometimes we're not used to seeing a caregiver stand there and wipe their hands for 30 seconds. They take a squirt off the little bottle by the door, wipe their hands for like real quick, and then grab something. And that's not going to work. They're saying you need to stand there for 30 dedicated seconds and let this drug, let the alcohol do its job and kill that virus on site. But the interesting thing that I found, and I'll scroll down to it, is where they have a table here. It was a 30% alcohol did the trick. So you see the concentration. So if you see the concentration,
rubbing alcohol is better than hand sanitizer. That's basically what you're saying.
Yeah. So the tall bars on the left, where it's over the 0% and 20% concentrations, that's the virus still living. Okay. And then at 30, 40, 60, and 80, the virus is dying. So a 30% concentration of rubbing of the ethanol in these hand sanitizers actually did the trick in the lab. The CDC has not budged though on their 60% recommendation. So they're still saying 60%, though in the lab they found that 30% does the trick.
Why does it go up on this other diagram at 80? It went up, looks like it shoots up to 4.8.
That's a different mechanism of death. So cytotoxicity. So that's like death to your own cells. So when you rub your hands in like 100%, then you're actually damaging your own cells, which you don't want to do either, because it leaves you prone to other infections. So that's too good. But
like when you make your hands so dry that they start cracking and they're bleeding. My daughter had that problem last week.
So like, here's the last sentence.
Washing your hands is fine, but don't wash them to the point where they dry and crack, and then you got bigger problems.
So here's their conclusion. In addition, ethanol and propranolol were efficient in inactivating.
Where are you reading here?
The middle of the conclusion paragraph. It says, in addition, the third line down.
I see it. Okay, yeah.
In addition, ethanol and propranolol were efficient in inactivating the virus in 30 seconds at a concentration of 30% or greater. Alcohol constitutes the basis for many hand rubs routinely used in healthcare settings. One caveat to the study is the defined inactivation time of exactly 30 seconds, which is the time recommended but not routinely performed in practice.
Okay. So ethanol, is that just rubbing alcohol?
No, it's the rubbing alcohol is different, but ethanol is what you can ingest. That's like in alcoholic beverages. And then propranolol would be your isopropyl alcohol, and propranolol would be the other like rubbing components. Isopropyl is what we have with rubbing alcohol. So they didn't study that. But so ethanol-based products is what they're talking about here.
Ethanol-based products.
Yep.
So that would be the drinking alcohol-based products. And are those what you typically see in stores? Are those ethanol-based products?
Yeah.
Or okay.
So all the commercial rubbing alcohols are ethanol based.
Oh, they're ethanol based.
The commercial rubbing alcohols the commercial hand sanitizers are ethanol based. And then a bottle of vodka's got ethanol in it. So you get a serum ethanol level when someone's got a DUI or admitted to the hospital for ingestion. And so the FDA is still saying they don't recommend people trying to make their own at home with like vodka because you still don't know, like some of these proofs are like they're 42 proof, which is 21%, and that's not enough. So you need to make sure that you had something that's at least 60 proof to get that 30% that they're talking about. But I don't think that we're that desperate that you need to go doing vodka at this point. There's plenty of people out there that are cranking out ethanol based hand sanitizers. Like every distillery and brewery in town is like it seems like, and they're all for a great cause. They're doing fundraisers with it. So go that route instead of going to the store and buying a bottle of vodka to pour in your hands.
So tell me about rubbing alcohol. How does rubbing alcohol compare to ethanol based hand sanitizer?
I don't know that they studied it in this. Let's see, they didn't study it in this, but the idea is that if you're going to use rubbing alcohol, you use one of the like 70% or 95% ones. And the idea is that if you allow it to dry on your hands or whatever surface, the drying is what kills the viral particles.
Oh, okay. All right.
And then you heard the gentleman from DHS say that bleach does the same thing. You can spray it on bleach and it kills it within 30 seconds.
Okay.
And that was during the press conference before we came on here.
So what if you sprayed people down as they walked in your business with, I don't know, bleach and a spray bottle, head to toe? Said, all right, you come in here, we're gonna spray you down. If the virus was on their clothes or on their bodies, would it kill the virus? They said something about porous and non-porous surfaces. What do they mean by that?
So a porous surface would be their clothes. A non-porous surface, you think about like a metallic, like door handles, glass.
What is the skin? He made it sound like the skin was non-porous. Is that right?
No, I'd consider that porous.
I thought so too. He said it was non-porous.
Yeah, I missed that. I missed that mention or detail. So I'll have to rewind back on the DVR and check it out and see. And I'll try and get these slides for tomorrow. But I guess to go back to your hypothetical of spraying people down with bleach. I don't think that's practical to spray bleach necessarily. I mean, there may be some other decontaminant solution, but I don't think it'd be bleach based because you'd be ruining a lot of clothes that way. And
what are they doing in China? Their spray bottles. What are they spraying people down with?
I don't know. I don't know. I hadn't researched that either. My guess would be that it'd probably be an alcohol based solution. And it may have like some other carrier agent with it, like a glycerol or something mixed with it. That'd be just my guess. But I don't to spray people down with bleach. I just don't see that being practical. I think that'd get cut off. That'd get cut off on multiple levels before it got to the point of being allowed to be used in a community.
Right. I'm just trying to figure out how any of this makes our living situation any better at this moment. It doesn't. I don't know. Other than
Well,
washing our hands and washing our surfaces with all these substances, but we still got the aerosol issue, and we're breathing this stuff. So, and if 60% of the people are asymptomatic and they're breathing around us, you can have all the hand sanitizer in the world on the surfaces, but if you're walking into a cloud of stuff and you breathe it in, you're done.
Well, and that's what the DHS said is, he said if you suspended these things in a bucket in air and you heated that bucket up or made that contents in that bucket more humid, then the half-life goes down. So it may be suspended in the air, but it's inactive much sooner than in an ambient environment. So he was saying, getting to 95 degrees and getting the humidity up to, I think it was like 60 or 80% I saw, would lessen the likelihood that there's an active viral particle hanging in the air. It's inactive at that point. It may still be there, but it's inactive.
So air condition is bad for another reason. It's bad because it's circulating the virus, but it's also bad because it's keeping the temperature lower.
Yeah. Mm-hmm. So if I guess if there's something to come of this, it's going to be let some fresh, warm air and humid air come into your abodes or closed buildings, and that may be one way to try and lower the half-life of these things.
All right.
So that's all I had for today as far as interesting. Actually, you know what? Hold on, let me see if I had one other one on here. Oh, I'll share this one on here. I got this in the mail here, and I'll send Michelle as well. So this came out. They surveyed Florida physicians. 99.6% of them experienced some reduction in revenue. 72% of respondents have reduced physician compensation. Yeah, I mean, they're putting numbers on stuff we knew. And you're seeing that physicians are applying for loans, laying off staff, or considering laying off staff. So the numbers are there. So this is the Florida Medical Association.
42% have laid off staff. That's a lot.
Yeah.
An additional 30% are considering layoffs. That's 72% of the people that work in doctors' offices. And that's a lot of unemployed people.
Yeah, so there's a lot of doctors' offices that were affected by the no elective procedures. You think about like joint replacements, you think about plastic surgery, you think about oral surgeons, you think about a ton of things, really, dermatologists. You think of a ton, and they're impacted by this. So this just puts a number on it for people to see statewide that the offices are ready to open. And I think I said this earlier this week is here locally we have plenty of ventilators open at the moment. So do you start seeing a loosening up on operating room time and allowing some of these elective procedures to go on, and kind of meter it out from there? I don't know. That might be part of the answer. And then then in turn, the offices start opening up because they have to follow up these elective cases. You get your knee replaced, you have a post-op visit the next week, that kind of stuff. Right. So I think it gets all the wheels going in one direction. But if I had to pick one thing, my choice on what to open up first, it'd be stuff like that because it's more controlled as opposed to, hey, let's open up the beaches, or hey, let's open up whatever.
Movie theaters, right?
Yeah.
Okay.
Yeah.
All right. Well, Dr. Malone, we thank you for sharing all that information, especially all the work you do to grab all these sources to make sure we're getting reliable information. We appreciate that very much. I hope our numbers keep going down instead of, they seem to be leveling or going up a little bit actually this week. So my hope is that by tomorrow we have a definitive downward turn. But if we don't, we want to make sure we report that to everybody. Again, we're seeing clients for all kinds of personal injuries still. The office is open pretty much 24/7 and taking new clients. Everybody's off in their remote locations doing work for our existing clients, and we're here for you. Dr. Malone, we appreciate it very much. You can find us on the web at zarzaurlaw.com. You can call us at 855-HIRE-JOE. You can comment about this video underneath this, or you can email us at info@zarzaurlaw.com. Y'all take care. We'll see you tomorrow. Thank you, Dr. Malone.
Yep.
Thank you all for watching.